If you're living with Crohn's disease or ulcerative colitis, there's a good chance you've been through the cycle: flare up, medication adjustment, maybe a procedure, things calm down for a while, and then it starts again. And somewhere along the way, someone told you, either directly or indirectly, that this is just something you deal with, that remission is the goal, that you should be grateful when the bleeding stops or the pain quiets down enough to get through the day. I want to respectfully challenge that idea. My name is Dr. Darren Schultz, and I've dedicated my practice to working with patients who have autoimmune conditions, specifically IBD, including Crohn's and ulcerative colitis. The patients who come to me have usually tried a lot. They're not new to this. They've done the biologics, the steroids, the elimination diets. Some of them have had surgeries. They're not looking for a miracle. They're looking for someone who asks a different question. And the question I ask is this: why is the immune system behaving this way in the first place? Because here's the thing: modern medicine is extraordinary at managing the fire, but it doesn't always stop to ask what's causing it to keep reigniting. IBD is classified as an autoimmune condition, which means your immune system is generating an inflammatory response against your own gut tissue. The standard approach is to suppress or modulate that immune response, and that absolutely has its place. But what if the immune system isn't the villain here? What if it's responding to something upstream, something in the gut environment, the microbial balance, the integrity of the gut lining, or even the cellular communication happening at a level most conventional workups never look at? That's where our approach begins. Over the next several videos, I'm going to walk you through exactly what we do, and more importantly, why we do it. We're going to talk about the gut immune connection and why nutrition is the foundation of everything. We'll get into peptide therapy and what it means to actually signal your body toward repair. We'll cover stem cells and exosomes, and I promise I'll make that make sense. And we'll talk about red light therapy and why the science behind it is a lot more compelling than it might sound. None of this is magic. All of it is science. And all of it is aimed at one thing: helping you get more of your life back. If you've been told that learning to live with your disease is the best you can do, I'd like to offer you a different conversation. Stick with me through this series. By the end of it, you'll know exactly how we think, exactly what we do, and whether this might be the right path for you. I'm Dr. Darren Schultz of Infinite Chiropractic and Regenerative Medicine. I'll see you in the next one.